Mimi Tran is an emergency room physician at the Milford Regional Medical Center. She graduated from MIT and completed a medical school and residency at the UMass Chan Medical School. Her parents are refugees from Vietnam, and she's a first-generation college student and the first to become a physician in her family. Growing up in an immigrant household taught her a great deal about the struggles of immigrants and refugees and what they face here in the U.S., including access to quality health care, education, and the like. The Worcester Refugee Assistance Project, which began in 2012, she began as a volunteer to help Burmese refugees and children achieve self-sustainability. In 2015, she became a board member, and in 2018 became a youth group coordinator of the program. Finally, she served as the RAP interim executive director during 2022. So contributing to this nonprofit work has been a fulfilling activity in addition to her practice in emergency medicine. And I'd like to talk to you about your experience in encountering the education system and getting into medical school personally, as well as what you've observed once in practice with the refugees that you have helped. So talk to me about your experience and your parents' experience coming here.
So sort of growing up here was very different for me. I went to mostly the Auburn public school system, and I found that I didn't have a lot of support at home when it came to school, and I was often doing a lot of translating for my parents when it came to mail, going to the doctor's office, applying for different federal aids, such as heat assistance or mass health, or obtaining food stamps. So I was doing all of this as a kid for my parents, just filling out these forms. And I remember a lot of it being super difficult, not understanding things about mortgage and filling out those types of applications, and just being awfully afraid and not really knowing what I was doing. But my parents were always pushing me and saying, just learn, and then you could, help us figure all these things out. And that was definitely a struggle for me, my sister, and a lot of my cousins too. We were often sort of the first line for our parents to do basically everything here in the US. And so because at such a young age, I was sort of taught to go out and learn these things, teach myself how to do these things, it sort of gave me that experience to be able to, in any field, just sort of figure things out on my own, get into college, navigate that, the school system on my own. But it was definitely a struggle for all of us involved.
Mm-hmm. And having gotten through medical school and a residency, you also felt that you would like to give back and work with the refugee community.
Yeah, absolutely. I remember sort of at the end of college coming back to Worcester and thinking, I want to find a community that I can work with, that I can sort of really give my all to. And I searched up refugee assistance in Worcester, and I found the Worcester Refugee Assistance Project, which was actually started by Meredith Walsh, an RN who was studying in the nursing program at UMass. And so she had started this with a group of people from a church, and they were basically helping Burmese refugees with anything that they needed. Again, like applying for legal assistance, federal aid, helping the kids with schoolwork. And she basically set up these night sessions on Mondays and Thursdays where we would all meet with the Burmese parents, the kids, and if the parents needed assistance, we'd be sitting at tables helping them. If the kids needed help with homework, we'd be doing that with them. And that really grew over the past decade. And now we're assisting a lot of the Afghan refugees who just recently came over to the US. So It's been super fulfilling, and being able to really identify with the kids, and say like, look, I understand it's really tough at home, and I understand that your parents really rely on you for a lot of things. Like, I get it, I've been there. And just to be that support for them has been, I think, really huge. And we've gotten a lot of these first generation students to go to college locally, and it's been
Mhm.
pretty amazing.
And as far as the medical conditions that you encounter, uh, are there any differences there with regard to that? How do you deal with that?
When you say medical differences, what do you mean?
Are they coming with different medical problems than you would encounter in your ordinary practice?
I would say typically not. A lot of them are going to see the physicians at the sort of the Edward M. Kennedy and the Family Health Center community centers in Worcester. I have not heard of any specific medical differences or anything that sort of pops out.
Hmm. Have there been changes in access to medical care during your time with RAP that you've
Um,
observed? Have things changed in any way?
I think that a lot of things sort of changed even as I was a kid. I remember being my mom's like translator at the doctor's office, and I know a lot of that has changed. Even as a resident, I've noticed there's a lot of push to use interpreters, get the iPad, get the telephone on, like every person should be offered an interpreter.
Mm.
And as a kid, I don't remember that being, important. And now it's pretty awesome that, everybody is having access to interpreters. And I think that really helps a lot with regards
Mm.
to medical care. Um, and I know with the Afghan refugees who recently came over, there was a problem with getting interpreters because there are so many different dialects. There was a problem getting the interpreters over the iPad, and so we helped one of the physicians, Dr. Payal Modi at UMass. She pushed the interpreter services to get 24/7 access to Pashto Dari, the dialects for the Afghan refugees, because we were starting to see a lot more of them come to the emergency department. So language, access to language is very important for
Mm.
refugee health.
And since you began with RAP, what would you say the evolution of refugees has been as far as where they're coming from?
You mean like sort of since 2010? So we saw a lot of Burmese refugees locally, and then in 2021 to 22, we were seeing a lot of Afghan refugees. Right now, we're seeing a lot of Haitian refugees,
Mm.
um, and a slight increase in the Ukraine refugees, but they're more towards Springfield. But so in Worcester, we've seen quite a few waves of refugees come
Mm.
through Worcester.
And in sum, what other comments would you like to make about the your involvement with the refugee population and their needs and your ability to help?
I think that it's important for all of us to remember that at some point, one of our family members was probably a refugee or an immigrant to this country, and realizing that it's very scary for immigrants and refugees to access healthcare in the United States. They don't speak the language, and they're worried about their health, and they sort of, if they don't get the care or the need that is a human right, then they'll probably, they'll just stay home and they won't access healthcare, and they won't go out there and look for things if they're afraid. So if we can assist them in any way, I think that we all should.
Hmm. Okay. Thank you so much for taking the time to meet with us today.
Of course. Thank you for having me.